knock. Okay, got the curtain pulled for privacy. Mr. Friend, I'm Glenn. I'm going to be your nurse today. Can you tell me your name, date of birth? And
Correct.
it gels with the computer. I've already looked in the chart. The doctor wants us to change this. Last time it was changed was last week, although there's no indication that it is. Luckily, it was charted in the computer. Make sure that our name, our date, and our initials and all of that's there. So first thing I'm going to do before I open any of this is I'm going to do some hand hygiene, clean my hands, make sure they're good. And then I'm going to grab some gloves and I'm going to take that dressing off. And that's the part that I think is the worst for most of my patients. So it'll maybe tug a little. I'm going to try to keep from tugging it too much. And I'm going to make sure that when I'm done, I'm going to flush these and I'm going to add another cap because somebody forgot to put it on or it fell off. Okay, when you're taking this off, you want to make sure that you take it from the distal end. You want to pull it up towards their head, and you don't want to try to do this because that would hurt. Okay, there we go. You want to pull their skin back from the dressing as you're pulling because it hurts pretty good. And if they have hair, then it's worse. You want to make sure you pull a little bit from each side. You don't want to do one side and then the other, you know, all the way, because you want to make sure you have control of how it pulls out. As I'm pulling, I'm looking for any striae, any redness, any swelling. Then I'm going to take this off. This would be sutured. You say you're going to have to kind of twist it a little bit because it's got a little split there. Okay, and then I'm going to take these off. And I'm going to be keeping my eye on that because I want to make sure nothing gets on it. I'm going to do some more hand hygiene. Get my hands. I want to make sure I have my flush and I have my caps for when I'm finished. So first thing I'm going to do is I'm going to open up my dressing change kit. There we go. And I have my trash right here. Do a little more hand hygiene. Make sure I got it good and clean. I'm going to have this set. I'm going to pull it. And then I'm going to pull either side. And then I'm going to grab this and pull it down. My tape is sticking. Luckily, I don't really need the tape, so I'm just going to kind of let it go. All right, first thing I'm going to do is I'm going to put my mask on too because I don't want to breathe on the site because I'm going to be getting pretty close. Then I'm going to put on my gloves. And I'm going to get down here and kind of turn this a little bit so it's easier for me to use. Before I put my gloves on, I'm going to put on my BioPatch. You got to open it up sterilely and dump it into your sterile field. Okay, then I'm just going to dump it. And I'm going to lay that there, but I will get that off before I leave. Mr. Friend, you doing okay?
Yes.
Okay, cool. All right, make sure that I put on my dominant glove on my dominant hand. Try to get it in there. Hopefully you do it that way and your hand doesn't get all messed up. And then you're going to put on your non-dominant hand. I like to pull them away from my tray so that I don't touch the tray with it. Make sure your thumbs don't become friends. And I have a trash bag if I need it. There's triple antibiotic, but we don't put that on there. There's a scissors. We're not going to be cutting anything, so we want to make sure we put the BioPatch on the tray so that it doesn't get lost or get pushed off. And I'm going to start with the cleansing sticks. And as I'm sitting there looking at it, I'm just double checking. When I was taking it off, I could feel that there was no sub-Q air or anything like that. You're going to start in the middle, kind of twirl this as you go and work your way out a little bit, and then drop it there. Then you're going to do again a little feather out, and that should be laying flat, but it's kind of hard to make it. And then one more time, you're going to go out, and then I like to take and kind of clean those. Usually I would have taken and cleaned the patient with those chlorhexidine wipes before I started this and before I took off the dressing. All right, and then we're gonna do this one more time. We would just wanna make sure that it's nice and clean, and I just put that over that, but okay. And then a little more, kind of clean there. And then one more time. And you want to make sure you get as big a circle as you can around there. Then I'm going to get my bio patch, and it has, if you can see, there's little arrows right there. That goes towards their head. So it points up, and you want to kind of tuck it under here. It's a little hard on the mannequin, but you want to tuck it under there while that's sutured. You got to be really careful and kind of turn it and then pull it. We do this on all our central lines. It's going to be on your PICC lines as well. Once that is done, then I'm going to take my dressing. There's a little thing right there that I can write on. I want to take this off, and you want to make sure that you position it so that it'll stay best. Sometimes this way is good, sometimes this way. For this mannequin and for this person here, Mr. Friend, it's going to go this direction. Try not to pull it too much, because if you pull it, it's going to pucker. You want to make sure that you get it pushed down really good. If it's up on their neck, you want to make sure while their head's pushed over that way, that it gets put on there. And I try to make sure that it gets put down a little bit like that. Then we're going to peel this off. Sometimes you have to push it back on your patient. I always make sure that it comes away without the bottom part. And if you pull it when you put it on, it's not gonna be a very easy thing to do. So then I am gonna put today's date. Let's see, what is it, 15, 16, 10, 16, 20, 25, and then I'm gonna put my initials. And once I've done that, I'm gonna pull this off of here. And generally, you're gonna put it somewhere that's not covering. You don't wanna put it like right over here. Some people put it here, sometimes you put it over to the side. I try to put it somewhere that it's not going to block my view of my dressing and my insertion, and where it's, you know, so I can tell if anything's happening around the insertion site. And then, and then I'm going to take this there, clamped, which is good. I'm gonna undo this, and I have alcohol preps, so I'm gonna get one before I put it in there. Oops. And then I'm gonna clean for 15 to 30 seconds, just depends on how dirty it is. If these are really bad, and if I'm changing this for the week, sometimes we just go ahead and take them off. And when I flush, I'm gonna flush a little bit, and then I'm gonna pull back to check for blood return. So I'm gonna flush just a little, and you wanna push pause, and you're going to re-clamp it before you remove this. Once you remove it, you're gonna get your blue tab or green tabs. You're gonna peel one off, and you notice I didn't let go of this. I didn't let it drop. You don't wanna do that, because it's not, you don't wanna get it, you know, let it be dirty again, even though that's technically what this is for. But you wanna just pinch, make sure that's on there good, and it's not gonna come off, because I've seen people put them on and they fall off real easy. Right now, my area is not sterile anymore. My gloves are obviously not sterile. So I'm gonna go to my next one. Excuse me, I put those on the other side, I apologize. And I don't have to worry about this being my sterile field, because obviously it's not at this point. It's just gonna collect things. So I wanna come over here, take that one off, and then I'm gonna clean 15 to 30 seconds, make sure that I get good around the hub, because sometimes there's blood around it. And then I'm gonna take off my lid. And when you do that, you wanna make sure that you don't get that back on there. So you wanna make sure you don't touch anything, you don't break fields, or you know, you don't touch the end of that to anything. Once it's on there, then I unclamp, flush just a little, then you're gonna draw back some, because you wanna see a blood return. And depending on the patient, I may flush the whole thing, but this one I don't need to, it flushes really good. So once I take that off, I'm gonna get my prep again and make sure that it's still good and clean. It should be. And then I'm gonna get my other green cap, and I'm gonna put that on. And so again, make sure that it's not gonna pop off, because I have seen them pop off. And then my last one. Okay, this time I'm gonna loosen that so that I can get it off easier. And one more prep. This time I might use 1 or 2. It just depends, because this one's been off. I don't know how long it's been off. If I'm really unsure of it, I could get a new one. I'm gonna kind of just clean good for 30 seconds or more. It just depends, you know, like if it doesn't look good, you don't want to stop at 30 seconds. You just want to make sure the end is good and clean. Then
how often should I change a dressing?
The dressing needs to be changed once a week, or as needed. If it becomes very soiled, if it just starts falling off, sometimes you'll go in and it'll be off and you'll see like 60 billion pieces of tape on it. Don't do that. If it's that bad that you have to put a piece of tape on, you might do that for the minute while you go and get the kit and change it. So, because that is a infection risk. You do not want to have to keep pushing it back down. So once a week or as needed. Make sure you document in the computer that you changed it and that you put the BioPatch on. You're going to chart that there's no, you know, like nothing, like what it looks like. If it has sub-Q air, you're going to say that. If it's a new thing, you would call the doctor. And if it is not a new thing, if it looks worse, then you're going to still call the doctor. But you're going to make sure there's no stray. You're going to make sure the site does not look infected, that it's not tender, more than just the insertion site, because that's going to be a little uncomfortable anyway. But if I touch around the outside like this and they're complaining of pain or I notice redness, then we need to look at that, because that could indicate infection, and that is one thing we don't want to have. These ideally are changed when you do your dressing change. So normally we would have these and they would have been on my sterile field, and I would have pulled these off after I was done, and I would have taken them off completely and had them and flushed it, and I would have clamped, take these off like that, and then I would clean around this site with another alcohol swab, because sometimes this gets a little bit of blood on it and you want to make sure it's clean. And your new one, I'll show you how we would normally do it. It would be over here, and I would have had this in the package, and I would have already had this ready and flushed just like this before I took the old one off. Then I would have that clean, and then I would put the new one on like that. Once I did, I could unclamp, and then I flush just a little, and then I draw back blood. You see the bubbles coming back? That would be his blood, I guess. And then once you've push pause, then you're going to clamp it. You're going to take this off, and another prep. And I know I'm using a lot of preps, but that's kind of the way the hospitals are going right now to prevent infection. Is anytime you access, before or after, you rub the site with alcohol and you clean it. Even a peripheral line. I wouldn't say, no, I'm not doing a peripheral line. I'm gonna do just the centrals like that. I like to keep these on all of them because it's nice to get in there. Doesn't mean you don't use the alcohol prep before you put something against it. Like if I were gonna flush this again, I would take this one off and I would clean it, and then I would flush it, then I would clean it, and then I would put my med, then I would clean it again, then I would flush it. And I know that's a lot of cleaning, but it is to protect the patients, because we want this to stay in there as long as it can. So, do you have any other questions?
What do I do at home with this?
If you're at home, home health or your discharge nurse, probably your discharge nurse, is going to start doing some educating as you're here. If you have a family member that can change it, especially since it's on your shoulder or your neck, it'll be easier for someone else to change it. If you absolutely cannot change it, they definitely will have home health coming and checking on you every day and making sure the site is clean. If, like for baths, you would cover it. There's some things that we can put over the top of it that would keep it from getting wet. Tub baths would probably be better, or washing down would be better. What other questions?
I'm just ready to go back to sleep.
Okay, alrighty. Do you want to leave your mask on?
Sure.
Okay, all right, well, we'll leave it on. Your stats are doing good. You're not having any issues, so I'm going to cover you back up. And I'm going to kind of put this over. I'm going to just kind of push it over this way to get it out of your way a little bit, and we can cover you. I'm going to clean my mess up, and then I'm going to put your bed down, because I don't want you to wake up from your nap and think you can just hop out of bed. Don't want you to fall. I will give you your call button. Here's your call button. You can push that whenever you need me or want to text or anything like that. Anything else I can do for you today, Mr. Friend? Oh, okay. He's already asleep. Okay, I'll be quiet. Let's go. Shh, don't wake him up.